All of these are blind people that can't see because of major cataracts, far advanced cataracts, and literally all of them will have their sight back at the end of the surgical procedure provided to them free by its written program coordinated by Dr. Jacob.
Odds are that if you live in rural Ethiopia, your chances of easily finding a surgeon to provide life-changing cataract surgery would be quite rare. While cataract surgeries are readily accessible and very common in other parts of the world, Ethiopia has had limited success in addressing this easily curable disease. But this past June, in just 5 days, Negele Arsi General Hospital Medical College changed those odds by bringing the gift of sight, free of charge, to thousands of patients who would have otherwise remained blind for the rest of their lives. The surgeries were performed by world-renowned eye surgeon Dr. Jacob Prabhakar and the It Is Written Medical Ministry, who worked closely with hospital founder Dr. Gudata Hinika, CEO Dr. Belaine Later and their team. Cataracts are the leading cause of blindness and low vision in Ethiopia. Although highly curable, this disease affects over 1 million people each year. Even more patients go untreated in rural Ethiopia due to the scarcity of surgeons and rampant poverty in the region.
You see, all these people were living with blindness, with disability and inability to see. Couldn't walk most of them. So now getting free surgery here, this means a lot.
A cataract is a condition where the natural lens in a person's eye grows opaque. Factors that can cause cataracts include eye injuries, too much exposure to bright sunlight, or vitamin deficiencies. Cataracts usually develop slowly and are most common in people later in life. Surgery to repair cataracts consists of removing the damaged lens from a patient's eye and replacing it with a clear plastic one. Negele Arsi General Hospital and Medical College began serving the community in 2017. In 2 short years, the hospital has provided gold standard patient-centered care to almost 1 million people who have accessed the hospital 6 days a week for outpatient clinical services. As well as inpatient, life-saving emergency and trauma care 24 hours a day, 7 days a week.
I must appreciate the workers at the hospital, and also the foreign workers played a very good role. The foreign nurses from the Philippines and other places, they took care of us, and the doctors that were there took care, absolute care, so much that we thank God that this hospital has come to stay in this place. And mostly now our college staff goes there. We have a clinic right here, but our clinic is not as equipped as this hospital, so we thank God that this hospital is nearby. Otherwise, the other place to have gone is either to go down to Hawassa, which is far away from us. So we want to thank God for Arsi Negele Hospital. We do hope that they will get many other equipments and workers that will help to facilitate health in this area.
Dr. Gudata sabab dhalate sabab uumame waa'ee dabale isaa kennu umrii isaa dheeressu ummata achirraa xaaree dhufee nu gargaare kanallee waa'ee kan jaalu isaanii haa kennu.
Since he was a medical student, hospital founder Dr. Gudata Hinika has always been dedicated to building healthy, self-reliant communities through education, health and action. For his part, Dr. Jacob Prabhakar has been providing cataract surgeries to needy communities throughout India and other parts of the world. It was but natural for these two visionaries to come together to bring the gift of sight to this destitute region. Dr. Jacob's immense compassion is matched only by his remarkable precision and skill. Dr. Jacob took less than 2 minutes per patient to perform each life-changing surgery. But making those 2 life-changing minutes happen took many months of intense teamwork on an international scale. The team at Negele Arsi General Hospital and Medical College provided extensive community outreach, logistics, highly capable staffing, and tireless patient care, which were crucial to the campaign's success. For optimal productivity, the hospital team set up the surgical theatre with specially designed operating tables on either side of Dr. Jacob, so he could very quickly and efficiently turn from one patient to the next, maximising each day's productivity so they could minimise recovery time for each patient. The team treated patients of all ages, some of whom travelled 2,500 kilometres to receive those miracle surgeries free of charge. Every restored vision came with its own unique story. While most patients lost their eyesight gradually into their later years, others were not as fortunate. One such patient was a 9-year-old girl with congenital cataracts in both eyes. She had been blind since birth. If not for this blessed opportunity, she would have spent the rest of her life in darkness. It took her a while to register what was truly going on. The blank stare she came in with was gradually replaced with wonder and awe as she began to put name to voice and voice to face. It was truly life-affirming to witness the joy on her parents' faces as she looked at them and truly saw them for the very first time. For Dr. Gudata, Dr. Jacob, it is written, and the team at Negele Arsi General Hospital and Medical College, this mission set records on so many levels. First, it is the highest prevalence of cataract disease identified in a concentrated area in a matter of weeks. Second, this is the greatest number of cataract surgeries provided within just 5 days. And third, at under 2 minutes per procedure, this is the most rapid cataract surgery safely performed per person in Africa. In spite of all these firsts, the need for additional cataract care remains immense. Out of the 15,000 qualified patients, only 1,028 of them received the gift of sight. We look forward to continuing the progress we have made and invite you to join us in building hope, health, opportunity, progress and education in areas where care is scarce.